Hello and welcome. We're going to be talking about something that is so personal and honestly can be really confusing, how the medications we take might affect our sex lives. This is a safe space to get curious about those things you might have been wondering about. So let's dive in together. So let me ask you this. Have you ever had that little feeling, that inkling that something has changed? That maybe your birth control or your antidepressant is having an impact on how you feel or how your body responds intimately? If that thought has ever popped into your head, I really want you to know you are so far from alone.
And this is probably the most important thing you'll hear today. It's not just you, and it is absolutely not all in your head. The changes you might be feeling, they're real. They're recognized physiological responses. And you know what the best part is? They are often treatable. This is not something you just have to put up with.
Okay, so what is actually going on here? Understanding the science behind it, just what's happening in your body, well, that's the very first step toward feeling like you're back in the driver's seat. Knowledge really is power here.
So let's start with hormonal contraceptives, like the combined pill. They can sometimes create what's known as the SHBG trap. You see, the pill can make your body produce way more of a protein. We're talking up to 400% more, called Sex Hormone Binding Globulin. Just think of it like a little sponge. And this sponge goes around and soaks up all the free, active testosterone that your body needs to feel desire. This can lead to a lower libido and even things like vaginal dryness.
And what about SSRI antidepressants? Well, they do an amazing job of helping our mood by boosting serotonin. But that same serotonin can sometimes act like a bit of a sensation blocker. It can get in the way of the nerve signals your body needs for arousal and orgasm. Some women describe it as a kind of numbing feeling, and there's actually a medical term for it: genital anesthesia. It's a very real physical side effect, and it has absolutely nothing to do with your level of desire or your partner. So you can see how different methods can have really different effects. With the pill, the big concerns are often that lower libido and dryness because of that testosterone trap we talked about. For SSRIs, it's more about the mechanics, that difficulty with arousal and reaching orgasm. And then you have IUDs, especially the copper coil. Its effect isn't hormonal at all, it's more physical, and can sometimes cause discomfort or pain.
Now just take a look at this number, up to 70%. That is the percentage of women taking SSRIs who report some kind of sexual side effect. It's huge. So if this is your experience, you're not in some small minority. You are squarely in the majority. It's an incredibly common issue.
And this is a message we really want to sink in, and it comes straight from the experts at the Women's Health Clinic. They say, these side effects are real, treatable, and do not mean you must simply tolerate them. This is not your new normal. This is a problem, and problems have solutions.
So, who is guiding us through this? Well, this information comes from compassionate experts who live and breathe these issues. I'd like to introduce you to Dr. Farzana Khan, who is a clinical lead at the Women's Health Clinic.
Dr. Khan's background is just wow. She earned her medical degree from the University of Copenhagen, has over 2 decades of experience, and she also holds a special diploma in sexual and reproductive health. Her entire clinical focus is on vaginal health and sexual function. This is truly her area of expertise. And what I love is her whole philosophy of care. It's really a partnership. She's all about clear explanations, setting realistic expectations, and, most importantly, making decisions with you, not for you. That's the kind of care every single one of us deserves.
Okay, so now that we get the why, let's talk about the what's next. This is the empowering part. The actual steps you can consider to start reclaiming that feeling of comfort, connection, and intimacy in your life.
Here are a few things you can think about right away. First, just talk to your partner. Explaining that this is a physical side effect can take so much pressure off both of you. Second, never underestimate the power of a really good lubricant. It can be a total game changer. It's also a great idea to explore other kinds of intimacy that don't put so much pressure on performance. And for some women, even just adjusting when they take their SSRI dose, maybe taking it after being intimate, can make a difference.
And these are some really solid medical options you can bring up with your doctor. You could ask about trying a non-hormonal contraceptive, like the copper IUD. You could talk about whether there's a more libido-friendly antidepressant that might work for you. And if dryness is the main issue, asking about topical estrogen is a great idea. These are all starting points for a conversation with your doctor.
Okay, and this is so important. Please never, ever just stop taking an antidepressant. Stopping suddenly can be really serious. This whole process is about working with your doctor to come up with a safe, gradual plan that takes care of both your mental health and your sexual health. So, as we start to wrap this up, let's just focus on the simple power of starting a conversation. Advocating for your own health. That's not being difficult, it's being your own best champion.
Let's just bust this myth one last time. The idea that this is all in your head, it's just not true. The reality is, these are real, well-documented biological reactions. Your body is having a physical response, which means your concerns are 100% valid and they absolutely deserve to be heard.
So I'll just leave you with this one thought. What if the journey back to feeling more like yourself isn't some giant impossible leap? What if it's just one small, brave step? The step of simply asking a question. Thank you so much for being here with me today.